If traditional therapy and meds have not worked out for you, don't lose hope. There are newer and better treatment options for depression. Joining us now is psychiatrist Dr. Khaled Bowarshi, who's here to tell us more. Welcome to Bloom, Doctor. Thank you so much for joining us.
Thank you very much for having me.
I know this is a relief for people suffering from depression, because many have lost hope. They've tried all the traditional medications that are on the market, talk therapy, and still no results. So talk to us about what's on the forefront or here right now for treatment options.
Absolutely. It's actually one of the symptoms of depression, hopelessness, right? So not only that we have tried so many things in the past that might have not worked for depression, but baked into depression itself that some patients could feel hopeless. It's never been more exciting times to be a psychiatrist nowadays because of all the innovation that are happening in the field at this time. So there had been at least 2 to 3 treatments that just emerged in the last couple of years, and there are many more to come in the near future. One of those interesting treatments is a derivative of ketamine called esketamine that just got FDA approval in March of 2019. So ketamine, you might have heard of Special K and illicit drugs that used for partying and what have you in the past, and it's also used for anesthesia for patients who needs to go through surgeries or what have you, and it was approved since 1970s basically for that reason. Recently, in the last maybe 10 years or so, we use ketamine in an IV infusion to help patients with depression and anxiety, PTSD, etc. The problem with that it wasn't yet FDA approved at that time, meaning that we did not assure a good safety way to administer such a drug. Here recently, we have a derivative of ketamine called esketamine that is administered via an intranasal spray. And I brought in, a sample of the trainer device that we give to patients during the treatment. So instead of having an IV line and an anesthesiologist administering the drug, basically the patient can do the inhalation themselves under supervision of a psychiatrist, like in our office. And then we monitor the patient for the next 2 hours to make sure that they're safe and they do not have any side effects or adverse reactions to the treatment. The beauty of such a treatment is that it's very fast acting. We're talking about suicidal thoughts going away in about 24 hours, and we're talking about achieving remission or knowing that whether somebody's going to remit with the treatment or not within about a month of the treatment. It's done twice a week for about a month, and then after that, once a week for the second month. It's approved, so that means that insurance will cover for the treatment, and it's available in multiple clinics in our area.
Oh, that's very promising. But again, this all has to be done under doctor's supervision.
Correct.
Okay.
This is a controlled substance, meaning that it could be addictive, and for this reason we need to make sure that patients don't misuse it. And for this reason, it's only done at the doctor's office, and it's under a very strict program by the DEA and the FDA to make sure that the patient is getting the treatment in a safe manner.
I see you've brought something else with you today that's been on the market for a while, but this is kind of the next level.
Yep. So if medication is something that doesn't sit well with the patient, or we are looking for something that is not medication-based, we are using advanced medical technology nowadays to stimulate the brain out of depression. And I brought an example of how a TMS coil would look like. TMS stands for Transcranial Magnetic Stimulation. Basically, we're using magnetic pulses to stimulate certain areas of the brain and bring it out of depression. This is not particularly new. It had been FDA cleared since 2008. But what's new nowadays is that we're trying to optimize the treatment protocol to provide the treatment instead of 6 weeks in just about 5 days. So we use navigation system to be more accurate about where we're putting the coil. So if you're looking here, we have some spheres that are reflective. And when somebody is in our clinic, there is a camera that looks at the patient and sends an infrared wave to kind of see where the coil is positioned at all times on the patient head. Think of this similar to your iPhone Face ID, right? It throws a light, and then it would take the reflection of that and it would unlock your phone. So if we can use such a technology to precisely administer the treatment, then we could actually be more successful with that. And not even that, we also do 10 treatment sessions in a day for 5 days, and we could use a functional connectivity MRI to decide exactly where we're going to treat on the patient head. And such a treatment had a tremendous a positive effect on depression and achieving remission within 5 days, for patients.
Yeah, I was just going to say, and sadly we're running out of time because I could talk to you about this all day, but I have talked to patients that, have undergone this treatment, and they said it was a game changer, and they had tried, which I think is a requirement, that you have to try talk therapy, medication first, and then you go to the TMS, but it worked for them, and I really appreciate you coming on and giving folks out there suffering some hope. So thank you, Doctor.
Absolutely. Stay tuned. A lot of newer treatments are going to get approved pretty soon.
All right, thank you, Dr. And for more information about depression and treatments available, just head to wfla.com/Blvd.